Good morning, everyone. Thank you so much for giving me your time and your attention today, and thanks to CSS for inviting Ottawa Public Health to share this information with you all today. As mentioned, you are an important part of the pandemic response. Many of you are frontline staff working directly with our community residents, and therefore you're a crucial part of having the conversations with residents to help them feel informed and confident in making the right decision for them when it comes to vaccination. So I look forward to having a chat and answering all of your questions at the end of the presentation. And without further ado, we'll just jump right in. So just a little disclaimer to begin. The information in this presentation was last updated on April 6th, so yesterday. And the information, as you know, is changing so quickly, so please consult Ottawa Public Health for the latest information on the COVID-19 response and the vaccine rollout. And the web address is here on the webpage. It's ottawapublichealth.ca/COVID-19. So the goal of today's presentation is really to build capacity amongst CSS staff. It's to give a sub goal is to give you the tools you need to support your clients in making an informed decision about COVID-19 vaccination. At the same time, it's also to give you as individuals the information you need as well to make an informed decision about COVID-19 vaccination for yourselves and for your families. So the information in this presentation is based on research and evidence. And just an overview of today's presentation, we'll start talking about the Ottawa vaccination plan. So that includes the logistics, the who, what, where, when. We'll touch on vaccine safety and how vaccines were approved. Then we'll go to what to expect when getting vaccinated, side effects to expect, what to do afterwards. And then we are including a special section here for service providers like yourselves on how to talk about vaccines. So this is going to be really practical and give you some questions to ask and things to say in order to have a sensitive conversation about vaccines. I'll share with you all some resources available that you can follow up on for more information. And then at the end, we'll have our Q&A. So just a small note to go with this slide here. This is from the Government of Ontario's website. So this is the phase 2 sequencing. And the sequencing of who gets the vaccine when is something that's decided at a provincial level. Our role at the local level, City of Ottawa, Ottawa Public Health, and all of our community partners, our role is to decide how to deliver the vaccines to people, but the province decides who is going to get the vaccine at what point in the sequencing timeline. So we are into April now, so phase 2 is starting, phase 1 is wrapping up. So there's a little bit of overlap between the two, but I wanted to focus the slide here on phase 2. So as of this morning, you may have heard, we are currently offering vaccines, or rather individuals over 60 can now register for their vaccines. Pharmacies in Ottawa are offering vaccines as well to individuals 55 and over. And other priority groups in phase 2, so we have priority based on age, but then we also have priority based on health conditions. So we have them broken down into 3 different categories, from highest risk, high risk, and at risk. And then we have congregate settings, which will be prioritized in phase 2, so high risk congregate living settings. Hotspot communities, so these are areas where that have been disproportionately affected by COVID-19. And then lastly, phase 2 will include essential workers who cannot work from home. And Once someone is eligible, if you were eligible as a 80-year-old several weeks ago, your eligibility does not go away. So you can still get the vaccine at any point in time. And in the instance where someone perhaps is an essential worker, but they also suffer from a health condition, then they could access the vaccine under whichever umbrella comes first. So if they have high blood pressure, for example, they may be getting the vaccine before, even though they're an essential worker. Does that make sense? Awesome. So now we'll touch a little bit more about the specific definitions for health conditions, congregate living settings, and essential workers. So here we have the eligible health conditions in phase 2. So they've been broken down by risk. And risk is a couple of things. It's likelihood of being exposed to and getting COVID, likelihood of also suffering complications and hospitalization and death from COVID-19. So we have our highest risk here, and people who fall in the highest risk category, if they have an essential caregiver, their essential caregiver will also be eligible for vaccination in phase 2. And I just want to note as well that currently, April 7th, people with eligible health conditions, the vaccine registration is not yet open for them, so that's still to come. And then in the high risk category, we have people who have obesity, people who are undergoing treatments that cause immunosuppression, so chemotherapy and other immunity weakening medications, and individuals with intellectual or developmental disabilities such as Down syndrome. So if someone is, for example, a 21-year-old, then but they do have an intellectual or developmental disability, then they would be eligible for vaccination in phase 2. And then we have the at-risk health conditions, and this encompasses many common health conditions, so including diabetes, heart disease, high blood pressure, even pregnancy. Phase 2 for the high-risk congregate settings. So this here is the list of all of the high-risk congregate settings that are eligible in phase 2. And for certain people who live in these high-risk congregate settings, their caregivers, their essential caregivers, one essential caregiver is also eligible for vaccination. So some of the high-risk congregate settings include developmental services, mental health and addictions congregate settings, homes for special care, children's residential facilities, and Indigenous healing and wellness facilities, amongst others here. And the last group that we'll go into detail for phase 2 is the essential workers. So this is where some of you may fit in. So we have the first group and the second group. So the first group is our teachers, elementary and secondary school workers, or I shouldn't say teachers, workers rather. So that includes everyone who would provide services for facilitating children being and going to school. We have workers who respond to critical events. So this includes EMS staff, etc. We have enforcement, inspection, and compliance roles. Individuals working in licensed childcare environments, foster care agenda workers, food manufacturing and distribution workers, agriculture and farm workers, and funeral and cemetery workers. Groups were prioritized based on the data that the province rather had or has, based on outbreaks, where the outbreaks are happening, and who is being most affected by these outbreaks. So this is how things were prioritized for phase 2. And then the second group of essential workers here, some that may be of interest to CSSD include essential and critical retail workers. This includes grocery store employees and many others that I could not fit on this slide here. It includes social workers and social service staff who provide in-person client services, so including youth justice workers, Ontario Works, and Ontario Disability Support Program caseworkers. And then other ones here that I won't list off. And just a note that I did not include every single essential worker on this slide. The full list can be accessed through the ontario.ca website here that's linked onto the page. So now we'll shift gears a little bit. We'll talk about how to book your appointment and how to book an appointment for someone else. So there are two ways to book your appointment. The first way is to book through the provincial portal. This can be done by phone or online. The web address is here. So this is the Province of Ontario booking system. This is where you can go to book at one of our community clinics here in Ottawa. You'll first need to confirm your eligibility online and then follow the prompts to book your appointment. So the second way to book your clinic is through Ottawa Public Health. So to book an appointment through Ottawa Public Health, you can only do it by phone. So you'll call this number here. And now, how do you know, why are there two systems, right? How do you know which one to go for? So if you live in a neighborhood where there's a pop-up clinic, so one of the hotspot communities, and that full list is on our website. I'll show you where you can access it in a little while. But if you live in one of the hotspot communities, you can book at a local neighborhood pop-up clinic by calling Ottawa Public Health. Alternatively, you can call Ottawa Public Health if you need further support in booking your appointment. So for example, if you need a service in multiple languages, or if you require some multilingual translation, some American Sign Language translation, Ottawa Public Health can accommodate those needs by phone. And the first step before calling still would be to confirm your eligibility. So we have a tool on our website where you put in your information, age, address, etc., and then it'll tell you yay or nay if you are indeed eligible. We cannot accept any walk-ins at any of the clinics. People must book their appointment in advance. And we've had some questions about end of day appointments to use up the doses that are still, that may be left over from no-shows, etc. And we do have a process in place to manage those leftover doses if that does happen. So there is no wastage. Currently, those leftover doses that may be there go to healthcare workers who have identified that they're available for a last-minute appointment. So we're going to be giving vaccines to people through various different methods. And on this chart here, you can see where we're going to be able to offer vaccines in Ottawa. So through all of these means, we're ready to give almost 11,000 doses per day at the peak. And this is, of course, supply dependent. So some of the ways that we're going to be reaching people are through pharmacies. And just a note on booking, I should have added, to book an appointment through the pharmacy, you need to book with the pharmacy itself. You can't book through public health and you can't book through the provincial portal. So for pharmacy bookings, you book through the pharmacies. So that's currently available in Ottawa since I believe, I want to say last week, but it's a time warp and can't keep track anymore. There's also mobile vaccination teams, and these are the mobile teams that are setting up those pop-up clinics in priority neighborhoods. We have 7 community clinics. These 7 clinic locations will not change, unlike the pop-up clinics. There are 2 hospital clinics, one at the Civic and one at Queensway Carleton. And then in the future, not currently happening, vaccines will also be able to be offered through doctors' offices. Now, how can you book? And here, actually, I'm going to go to this slide first. I'll come back to that previous slide in a minute. I just want to show you the map of where all the clinics are. So these are the community clinics, the set locations that will not be changing. So you can see they're from east to west. But really, people don't need to know this level of detailed information, because when they book their appointment, I know when someone books through the provincial portal, they're actually able to select which clinic they would like to go to, which community clinic they want to attend. So they're going to be presented the options at the time of booking. Now, going back to booking for other people. So you can support anyone to book their appointment. They don't need to be a family member of yours. They could be a client, they could be a neighbor, they could be a friend. And I really encourage you that if you are aware of someone in your community and your network who you suspect may not be the most technologically savvy, they may need a little bit of support, it doesn't hurt to ask them and to offer to reach out. It will take you, a few minutes of your day to book for them, and it would be very much appreciated, I'm sure. So all you need to book for someone else is to get their consent. Verbal consent is fine. You do not need written consent for this. And then you'll go online, you'll confirm their eligibility. And to do this, you'll need some of their personal contact information and background health information. So you'll need things like their name, their date of birth, their address, and other information that the online tool may prompt you to have. And then you'll book online through the provincial website or via OPH if they're eligible from one of those pop-up clinics. And the last step, you just share that information with the person that you booked for, whether it's forwarding them an email or writing it on pen and paper and giving it to them if they are not on email themselves. Now, how will people know when it's their turn to be vaccinated? I think that we've had some proven ways now to show people how the message will be conveyed. So PSAs are going to be shared via social media, on the OPH website, on the local news, on television, so on and so forth. And of course, many of you being frontline service workers, you are also a tool for people to get that information. So staying up to date on the latest and being able to share that with everyone is great. Another way is just by using the eligibility lookup tool, but definitely Ottawa Public Health is always available for a phone call if someone is wondering about their eligibility. I should add as well that OPH cannot make any exceptions to the eligibility because that's set at the provincial level. So we follow the provincial framework based on an ethical distribution of vaccines, based on risk and preventing illness and death and hospitalization. And our job is to support the community, but we can't make exceptions. So transportation to the clinics, not all clinics will be walking distance from everyone. So some folks may need a little bit of assistance to get there. People are first encouraged to make their own transportation plan if they can by connecting with friends, family, OC Transpo, or if they're a registered paratranspo user, they can use paratranspo. However, if people don't have a transportation option available to them, they can request a ride to and from the clinic at the time of booking. They'll be able to indicate at the time of booking if they need some support for transportation, and then a city partner is going to contact them to set up that appointment. This service is completely free, and it's just a shuttle to and from their house. and all they're going to be asked to do is to wear a mask and to follow COVID-19 protocols while they're in the vehicle with their driver. And also a note specific for CSSD here is that social assistant recipients can also contact their caseworker for help with transportation costs if needed. All right, I hope that helps answer your questions regarding logistics. And now we're going to go into a little bit about vaccine safety and how the vaccines were approved. And I hope that this next section will give you a little bit of the tools needed to quell people's fears and apprehensions about getting vaccinated by sharing with them the evidence of how things were done. So for how the vaccines were approved, so no steps were skipped in the development, review, or approval of the vaccines. Health Canada did an independent review of the evidence, and the vaccines are approved and distributed because they're safe and because they work. So some of the reasons why the COVID-19 vaccines were approved in record time is because of pre-existing research on those types of vaccines and on these types of viruses, because of new technology available to understand how the virus works much more quickly. There were also large financial investments through the global effort to fight this pandemic, so that removed all the financial barriers. And lastly, Health Canada used a rolling review and approval process. So they started reviewing the evidence for the sections of the study that were completed while the study was still ongoing. But at the end, all of the evidence had been reviewed, and vaccines are approved because they're safe and because they work. And I think to date, we have a lot of real world data as well that support the safety and efficacy of the vaccines. So here's a little chart from the Government of Canada to show how vaccines are developed through the clinical trial process. And so first they develop the vaccine, then the vaccine is tested in the lab before being tested on humans. Once this is proven to be a potential good option, then clinical trials can begin. And there are 3 phases. Phase 1, quite small, tens of volunteers. Phase 2, hundreds of volunteers. And then phase 3, there are thousands of volunteers, 30,000, 40,000, quite a few people from all over the world, from different ethno-cultural backgrounds as well, to really ensure that the vaccine is tested on a representative sample of the population. So speaking on ethnic representation, so some of the racialized people who were included in the clinical trials include Black, Asian, Latinx, and Native American people, and these folks volunteered to be part of the trials. And the evidence from clinical trials, as well as the real-world data, support the use of vaccines for people of all races. And hundreds of millions of doses have been distributed worldwide. Last I checked, and this was over a week ago, maybe 2 weeks ago, it was over 300 million doses worldwide, and I'm sure that number is increasing exponentially as well. So yeah, vaccines are being very widely distributed. Side effects are tracked closely, and vaccines continue to be approved because they're safe and they're effective. So now the vaccines that are approved in Canada, we have 2 types of vaccines. So we have, on the one hand, mRNA vaccines. These are the Pfizer and the Moderna vaccines. And then we have the AstraZeneca and the Johnson & Johnson vaccine. And these are both viral vector-based vaccines. So the similarities between these vaccines are that you will usually need 2 doses, with the exception of Johnson & Johnson, which I should add is not currently being distributed in Ottawa. And the other similarities include that none of these vaccines are made of a live virus. So the vaccines cannot give anyone COVID-19. And as I mentioned, they're all tracked for safety and efficacy, and that information is publicly available on Health Canada's website. So you can go see what are the most common side effects. They're all there, easy to read and easy to understand for the public. Some people may ask if they can request one vaccine over the other. So they cannot at this time. All vaccines are safe, they're all effective. The federal or provincial guidelines may, however, decide that certain populations should be offered a certain vaccine, but that's really decided at the federal and provincial level, and that's based on the research and the evidence. Other factors that could affect which vaccine you get include the supply, the availability at the time of vaccination, and the storage requirements as well. I just want to reiterate that all the vaccines are safe, and no population is being given a bad vaccine. Everyone is getting an approved vaccine. The pop-up clinics, the community clinics, everyone is getting a safe and effective vaccine. Now we'll touch on what you can expect when getting vaccinated. So why should people get vaccinated, right? That is the question of the hour. So really the main argument you can share with people who are asking why they should go ahead with this vaccine is really to protect themselves from COVID-19, because we don't know how COVID-19 will affect us. Some people are asymptomatic, some people have a little sniffle, a little headache, but some people can get really, really sick, and some people do die from COVID-19. We do know that the vaccine can help prevent serious illness, hospitalization, and death, in many cases after one dose, although you still do need 2 doses, but the vaccines are very, very effective at preventing illness. So right now, that's the best argument we can tell people, is to protect themselves. We don't know if the vaccine prevents the spread of COVID-19. Some evidence research on that is still emerging, so we'll know more as more and more people continue to get vaccinated. What happens after you get vaccinated? Can life go back to normal? So not yet is the answer we need to tell people, and part of the reason is that the vaccine does not give you full immunity right away. It does take 2 doses for most of the vaccines, for all the ones currently being distributed in Ottawa. It takes 2 doses, and then it takes up to 2 weeks after your 2nd dose to have full immunity. So in the meantime, and also because not everyone can get the vaccine at the same time, there's many people who are still vulnerable in the community who aren't vaccinated. So in the meantime, we just need to continue doing what we've been told from the beginning, following public health measures, wearing a mask, staying home if we're sick, getting tested, staying 2 meters apart from people. And with these new variants of concern that are spreading very quickly, it's recommended to really just stay with members of your own household only, unless you live alone, of course. Then you can combine with one other household exclusively. But also to maintain physical distancing from others, even when outdoors. And if possible, also wearing a mask when you're around other people outdoors as well. And then the last public health measure is hand washing, hand hygiene, hand sanitizer, all that good stuff. Some people may ask you what are the side effects and risks of COVID-19 vaccination. So some very common side effects that are Normal will occur in even more than 10% of people, include pain at the injection site, having a headache, feeling tired, muscle or joint pain, fever or chills, and having enlarged lymph nodes. Some common side effects, 1 to 10% of people. They will experience redness and swelling at the injection site, And then very rare side effects include a serious allergic reaction, such as anaphylaxis. And as mentioned, all of these side effects are reported. They're all publicly available on Health Canada's website for people who would like to go get that further information. In terms of long-term side effects, so clinical trial participants are still being followed. To date, no negative long-term side effects have been seen from vaccination. We do encourage people, if they experience side effects, to report those to their healthcare provider or to where they got the vaccine, so that Health Canada can track this information closely and continue to make sure that the vaccine is appropriate for everyone. All right, I'm just going to grab a drink of water before we jump into the next section here. Thank you all for sticking with me this far. This next section of the presentation is really geared towards service providers. So I've given you all of the information on who, what, where, when, safety, efficacy, what to expect. So you have all of the key messages, but now how do you share those with people? This is what this next part of the presentation will be. How to talk about COVID-19 vaccines. And we've developed this is based on a mental health approach, tactic program called Safe Talk. And it's really, the principle is to meet people where they're at, to get to know their personal situation, their beliefs, their knowledge, to be empathetic towards them, so validating their feelings and their beliefs, and then meeting their basic needs before sharing what's on our agenda, what we came in with the intention of sharing, and then leaving them with a very simple key message targeted for their specific situation. So those are the 6 steps on about how to talk about COVID-19 vaccines, and we'll go through them all in a little bit more detail. So step 1, meet the person where they're at. This is in terms of language. If you speak someone's mother tongue, then that's an advantage. If you meet them on their own turf, in a setting where they are comfortable and at ease, that is helpful as well. And then you also just want to approach people with an open mind and without judgment. You want to have a receptive and attentive attitude. You really want to give them the time of day and to make them feel like they are valued. In order to provide resources that truly meet the needs of the person, we need to listen to what they need and not assume that we already know it. So we can come in with our 10 key messages, but if the person is not ready to hear them, they're not going to be receptive to them. So we need to kind of get the lay of the land before we jump in. So how to meet the person where they're at. So stay authentic, use simple vocabulary, try to connect with the person on a personal level. This will help build trust in your relationship. Things you can say include, how are you? What's working well? What's not working well for you and for your family? Try to find a point that you have in common. Maybe say, I really like your shirt. Where is it from? Just something like a little icebreaker to make them feel comfortable around you. And then definitely always checking in, saying things, do you have any questions about what I just said? Giving them the chance to reflect. The second step is inquire. So get to know more about their own unique lived experience. And the principle behind this is to discuss the subject of COVID-19 and vaccines. You're going to try to learn about their values, their beliefs, knowledge, attitudes, and perceived risks. This information is really important because it's going to help you identify whether the person is receptive to vaccine, if they're like, good to go, sign me up right now, if they're on the fence, or if they are completely opposed to vaccination altogether. And this is really going to help guide how you're going to have that conversation later on in step 5. Things you can say to get to know more about how they feel towards vaccination. Ask them, how has the pandemic disrupted their personal and family life? Do they know anyone who has been vaccinated? What was that like for them? Do they think that a vaccine could help them and could help their family? And this is an important one, what could reassure you about COVID-19 vaccines? So we're not there to convince anyone one way or the other. And I think that's important to go in with that is our goal is really to share the evidence and share the research. And at the end of the day, people will make the decision that is right for them. It is not your job, our job to convince anyone one way or the other. But asking them like, what information is missing? You know, what do you need to have to make a decision? And then step 3, and like these are steps, of course, they're sort of all intermingled into the conversation, but the third step is to validate their feelings, accept their emotions, understand their point of view, respond with kindness. Don't reject, ignore, or judge their emotions. Don't say, oh, well, why don't you want to get vaccinated? That's silly. Vaccines are great. You know, we really want to be empathetic towards them because their feelings are real. And this does not mean that you agree with everything they say or that you're confirming their beliefs. This just sends the message that they're seen and that they're heard, and it's an important first step to build trust. Things you can say to validate their feelings without confirming their beliefs include, can you tell me more about that? It seems difficult, it seems challenging. I can't imagine what that would be like. I'm here, I'm listening, you know, thank you for sharing that with me, for telling me about this. Step number 4, ask and address. And this step is about the person you're talking to. So this is the time to answer their pressing questions before sharing what you have on your quote-unquote agenda. Like I mentioned before, they're not going to be receptive to what you have pre-planned if their initial burning questions are not answered. So in order to do this, you need to stay on top of the latest COVID-19 information, but it's okay if you don't have the answers. You know, you can't know everything, and there's a lot of info that is still to be seen. We don't know. Just acknowledge this, be transparent about what you do know where to go to seek out the answers if you know that they exist out there, and say, you know, I'm not sure about that, but what I do know is XYZ. Step number 5, recommend and inform, and this step is about you and the message that you want to share. So identify, based on all your previous information you've gathered, identify what could motivate the person to change or adapt their behavior, and then tailor the message for them. Consult them often, check in often, give them the chance to think and absorb what you're saying. The message should be clear, so the vaccine will help prevent you from getting seriously sick with COVID-19. And you want to motivate the person by clearly indicating the risks and benefits of vaccination. So the COVID-19 vaccine helps protect you from becoming seriously sick and dying from COVID-19. The more people get vaccinated, the less people will get sick, and the sooner society can return to normal. These are some key messages to share. It's everything that has been in the presentation so far. And then impart and educate, that's your final like one-liner take-home message, you know, register for your vaccine, you're eligible starting today. Check out Ottawa Public Health, check out their website for more information on all of your questions. And if you have a poster, a flyer, a business card, you can give that to them as a takeaway as well. So to summarize, these are the 6 steps. I understand that it's going to be an organic conversation. You're not meant to follow them all step by step. So that said, you know, I've covered a lot in the presentation, but the information changes so quickly that I wanted to show you our webpage so that you could see, you know, where you can find the information for yourselves. So I'm going to exit out of the PowerPoint and I'm just going to my browser here. There are 2 web pages I'd like to show you. So the first one is Ottawa Public Health / COVID-19 vaccine. And this is where you'll get a lot of the logistic information and eligibility information. So this button here, check eligibility. And then here you can see vaccination is underway for phase 1 and phase 2. And these are all of the people who are currently eligible for vaccines. So if we click here, for example, I wanted to show you where the pop-up clinics were. I'm going to click at pop-up clinics in high-risk communities right here. It takes me down to the drop-down menu, and you can see the high-risk neighborhoods here. So if someone lives in these neighborhoods, they're eligible to book through OPH by phone at a pop-up clinic. And then this handy little map here shows you where all of those pop-up clinics are located. And these are all of the addresses for those pop-up clinics as well. And we have rural pop-up clinics as well. There are 3 rural clinics available in Ottawa at this time. Yeah, so people will get that information as well when they're booking. And then if you continue to scroll down, down, down to the very bottom, you can see here, have a question. Read our frequently asked questions about COVID-19 vaccination. This is another really important page for you all to be aware, because this is where you're probably going to find the answers to the questions coming in from the community. So here you have questions divided in all of these categories. How to prepare, clinics, accessibility, eligibility, myths, safety, etc. So you just click down, it takes you here for the safety section, for example, and then you have access to all of these questions. And we update this based on what we hear from the community. So some questions that you may ask today, you know, if I don't have the answer and it's a question that's applicable to many people, we'll seek out the answer and then we'll update it on our webpage. So I wanted to share that with everyone, and I'll jump back onto the presentation now just to wrap up. So another resource available for you are the Ottawa Public Health mental health resources and also the mental health resources available through the city. And this is something for you, of course, and also for the people you work with. We have mental health resources in multiple languages for diverse communities, for multiple settings, for the workplace settings, for employers, and it's just a lot of good stuff on there. Some are by phone, conversation, some are online, so there's something for everyone. And here are some credible sources for COVID-19 updates. So for me, it's really, well, everything, but the day-to-day that I check up on is the Ottawa Public Health website. That's where I get the latest info on who's eligible when. Health Canada at the federal level, or the NACI, is a good place for information on side effects, vaccine safety, etc. The provincial level is a good place for information on eligibility, on the ethical framework. And then at the international level, there's a lot of great resources there as well. And just a little note, if you don't, like the website is good and all, but social media is often more accessible for people from their cell phones. Twitter is a good one to get our updates. I think that's probably where OPH shares, you know, the latest pulse. Facebook, Instagram, and YouTube is where we post some media releases and videos like that, some myth and FAQ videos. So check those out if you have the chance. And then just a little reminder to fill out the evaluation for this presentation. This is an abrupt end. I feel like this slide should come first. Thank you all. That concludes my spiel. Thank you for staying with me through all of this. And I'll turn it over to Gloria. And we'll share that evaluation link that I just mentioned in the chat box for you all to fill out. It's just 4 questions and it will take you 3 minutes, and we really appreciate your feedback.
Awesome. Thank you so much, Chantal. This was so informative, and so many pieces of the vaccine puzzle in terms of questions that we as staff have, both from a personal perspective, but also hearing from our residents, our clients, and the community at large. So this is very informative. And I'd like to thank everyone who have submitted questions so far. Certainly, Chantal, people are very engaged, as we have received some questions already. And what I'm going to do is I'm going to take a look here at our list. And if you're okay, and just making sure you had a chance to have a sip of water, get you prepared. So I'll start with, so we have a few questions that have come in, and one of them does have to do with the essential workers in phase 2 with the second group that you had spoken to early on. And so this may have already been touched upon, but certainly because it's early and enough people have asked it. Are essential workers in phase 2 second group eligible to get the appointment now?
Good question. So not yet. Essential workers are not yet eligible to pre-register or to simply just register for their vaccines. That will come in phase 2, and from the graphic that I pulled from the Government of Ontario's webpage just this morning, the plan as it currently is for essential workers to be here. I'm just going to pull it up so I don't give you a wrong date. Essential workers, right now it looks like the intent is to start in June. And of course it's supply dependent, right? But that's the intention right now.
Perfect, thank you. Next question is, how long does it take to confirm eligibility? Now, I know when I tested it out, it seemed to go quite quick, but that could have also been just me. So I'll pass it over to you just to see how long it does take.
I think at the most it could take 5 minutes. If you have all the information on hand, it could be even quicker, but you know, you need your health card number, so you may need to go and hunt that down later, further down somewhere in your house. But it doesn't take long at all. It's just a couple of questions, online, name, address, couple of clicks, yes or no boxes, and yeah, pretty quick.
Perfect. So let me see our next question. And this is actually a question that I've received quite a few times as well. What about staff who live in Quebec or Prescott Russell? Can they get vaccinated in Ottawa or in Ottawa, Ontario?
So the staff work in Ottawa, but they live outside of the OPH jurisdiction. Correct. Yeah, that's a good question. We've had that a few times. The answer is, you know, the like if you work in Ottawa, but you live in Quebec, for example, use Quebec as an example, you can get vaccinated in Ottawa when you become eligible because you do work here.
Excellent, thank you. So let's see. Are rooming house tenants prioritized in stage 2?
So a rooming house, it might fall under a high-risk congregate setting. I'm just looking at the list right now of all the high-risk congregate settings included in phase 2. Rooming house is not specifically mentioned, so I don't want to say no, because I also don't want to just give you a blanket statement. I think I would recommend going to look at the list of high-risk congregate settings to see if that rooming house might fall under some of the listed categories that are put there, because I'm not sure the details of the rooming house and who is there and what it's like. So I can't say yes or no to that, but I encourage you to go look at the details for the high-risk congregate settings to get hopefully a clear answer there.
Perfect, thank you. Let's see, next question. Are there any options to accommodate clients with mobility issues, at-home vaccination or mobile units?
So for individuals who cannot leave their home, we are still working with our partners to find a solution to reach people in their homes. We don't currently have anything in place for that, but it is something that we are actively looking into. In terms of people who may be able to leave their home but have mobility issues, all of the clinic sites are wheelchair accessible, and there are options for sitting while you're waiting, sitting while you're vaccinated, sitting while you're waiting after, and there are options to lay down as well if somebody needs to lay down. But yeah, regarding vaccines in the home, it's something that we're still exploring.
And I can add my 2 cents to that, Chantal, because I'm also helping on that as well, and I can confirm that it is very actively is being looked at very actively right now to see how we can support those who are at home. So just wanted to reiterate your comment there, Chantal, your answer. In regards, actually, I'm just going to go back, if that's okay, to the rooming house tenants, as I've just received some information that that we're going to be prioritizing rooming house tenants via congregate settings through our clinics through one of our partners with Ottawa Inner City Health. So if there's any additional information on that, we'll make sure that that we share that. Another question, and this is one that I actually just read about this morning. What is the difference between mRNA and viral vector-based?
That's a good question. Do you want to take that one, Gloria? If you have just been, or do you want me to take it? I can
No,
take it.
I was just asked the question, but I hadn't found the answer yet.
Okay, let me, here, can I stop sharing my screen? I'm going to stop sharing my screen because I need to go into my email, because I'm just going to pull up something that will help me answer that question in a much more eloquent way. Just give me 3 seconds. Would you like to ask me another question while I look it up?
I most certainly can do that. Let's see. Well, the next question is in regards to when will under 55 years be eligible for vaccinations? But that one I don't believe we'll have. We know that it's in this phase, but we don't have a timeline on that. It'll be based on the provincial order.
Yeah, so under 55, well, technically it's under 60 that is phase 3, and phase 3 is going to start in July. So we just know right now AstraZeneca is being offered to under 55, or 55 plus, I should say. But to be determined, we have, like, I feel like eligibility went down fairly quickly, but there are fewer people who are 80-year-olds than there are 70-year-olds and 60-year-olds and so forth. So the number of people we need to vaccinate just grows and grows and grows with each chunk of the rollout. So I feel like, it may take some time to get to 55 and under, but the plan is by July, phase 3 will begin, and that's when the vaccine will be available to the general population.
Perfect.
Okay. I'm ready to answer.
Okay, go ahead.
Okay. So the difference between an mRNA and a viral vector vaccine. So both vaccines prompt your body to have an immune response to the virus. So the mRNA vaccine is made with instructions to make viral proteins that gets put into the vaccine that goes into your arm, and then your body will have an immune reaction to that. For the viral vector vaccine, it's the same thing. It works with the spike protein, and very high level, it also helps your body have an immune response and to the spike protein. And then you'll have that immune response. You'll have those little fighters inside your body, and they are just gonna hang out. And when you're exposed to the virus, they're already gonna know how to respond, and they're gonna be able to fight the virus and prevent you from becoming seriously sick with COVID-19.
Excellent. Thank you, Chantal. We have another question. When and how are the second dose vaccine appointments booked?
Okay, yeah, great question. Sorry, I forgot to mention that in my little spiel about booking. So right now, if you book through the province, through the provincial portal, I believe that you are given your appointment for your second dose at that time. At the time of booking. If you book through Ottawa Public Health by phone, however, you'll only book for your first dose. And our current message is for people to continue checking our website to get the news on when and how to book their second dose if they book through OPH. The only exception to that is for Indigenous folks who have booked through OPH. Then they're going to get a call back for their second dose. And, that may change. Maybe it'll be a phone call from OPH, maybe it'll be a robocall, something like that, but to be determined. For now, the message is just check back on the webpage.
Great, thank you. Looking at a couple more questions, just looking at the time. And also, this is a question that's come up recently and I believe we actually speak to it from some other presentations, but there have been some questions on, is the vaccine halal?
Yeah, so I can say that the vaccine, the Moderna and the Pfizer vaccines are halal. That's not to say that the other vaccines are not. We're just still gathering that information, and we'll update our webpage with that as soon as we know more. But for now, we are working closely with religious and faith leaders so that they have this information as well to share with their, could I say congregations, with their congregations. So we're working closely with them, and if you do get this question from folks, then what you can tell them is consult with your religious or faith leader, and they will be able to give you guidance on that. Pfizer and Moderna are halal. And I'll just maybe touch on another question related that we've also gotten regarding Ramadan. So people have asked if they can get vaccinated during Ramadan, and our answer to that is also consult with your religious or faith leader. So OPH is working closely with them to give them the information they need, but that recommendation will come from people's faith leaders.
Great, thank you so much for that. And we'll have a couple of more questions. Will I need to be vaccinated every year like the flu shot?
To be determined. We don't know. I've heard, just from reading the media and stuff like that, I've heard yes, I've heard no, I've heard maybe. It's really TBD as we learn more about the vaccine and about the virus, and as the seasons change, and we can't really predict the future, so we'll have to wait and see. But the good thing is we're going to have all the facilities and all the processes in place for these citywide mass immunization clinics and campaigns. So I think we should be prepared if that's something that we will need to do.
Perfect. And we'll have the last two. So this one, will the family members of essential workers be able to receive a vaccine as well?
Not at this time. Unless that family member falls into one of the other eligible categories themselves.
Perfect. And just checking. Okay, so we have one more question. Let's see here. Do I need the vaccine if I already had COVID-19?
Yes. You do, because we actually don't know how long, you may have long-lasting immunity from having the virus, but there is research that shows that that immunity could be fairly short, and people have gotten the virus twice. Definitely, the recommendation is to get vaccinated, even if you've had a COVID-19 infection in the past.
Perfect. Thank you so much. I'm just checking to see if we have any other questions. And certainly if there are any questions, because if you're like me, you'll think of something later going, oh, gee, I wish I would have asked that. Don't worry, we will give you a mechanism that you can email us to ask questions, and then we can forward them to OPH for their response. So not seeing any other ones that have come through here. So what I'll do is just do one last check, and this is Chantal. I can't thank you enough. This has been wonderful. Thank you so much for your presentation, for answering all these questions, and we know how the information is ever changing. I'd like to say it's changing daily, but sometimes it feels like it's changing hourly. And so we very much appreciate your work on in staying on top of all of this and being able to give us the most up-to-date info. Before I close the event, just a few housekeeping items. Please do not forget to complete the evaluation of this presentation, and the link is being shared into the live Q&A discussion right now. As well, even though I mentioned it before, just a reminder that this presentation and this session is being recorded and will be available on the CSS SharePoint site under COVID-19 News. That link can be found above in the chat as well. Do let your colleagues know about the live French session to be held on April 13th at 1 p.m. And if you have not done so yet, and Chantal did mention this earlier, but please sign up for the OPH newsletter. That way you'll be able to receive the most up-to-date vaccine and COVID-19 information. They're on top of it, OPH has been incredible at keeping the website up to date, and when there are changes, being able or sending out the newsletter and the e-subscription. So we'll add that link as well to sign up in the chat. And if not, you can always go to the FAQ page or the COVID information OPH page, and it's right on top. And again, if you have any other questions that couldn't be answered from the comprehensive info found on the OPH page, don't hesitate to email us at hntf@ottawa.ca, and we'll do our best to find the response for you, to forward it to OPH, and we'll get back to you with responses on those. So I'd like to thank everyone so much, especially our team for organizing this event, and for Chantal for presenting. So thank you to Chantal, Linnea, Patrick, Julie, Noelle, Pat, Chelsea, Nikki, Maha, and Kim. It definitely takes a team to put this together. And a big thank you, merci, miigwech, kianamik, to all of you for attending and working so hard in helping our residents and our communities in this incredibly unprecedented time, working to help our residents and get them through to this next step of being able to be vaccinated, and anyone wishing to be vaccinated, giving them that opportunity and that information. I sign off saying, take care, stay safe, and have a wonderful rest of day. Thank you all so much.